Welcome back to the Ricky Mathews Show. I really enjoy visiting with my friend Jeff Duncan. Sometimes, we get two segments in, and I would love to be able to do a third segment. And every now and then we'll spend a whole show together. But I enjoyed catching up with Jeff. He's a terrific contributor to SuperTalk Mississippi, and I appreciate him being available to us. Listen, I've shared a couple of quotes about community leadership in the past, and I thought I'd share them again because these apply so well to the conversation we're about to have. But the first one is from Margaret Wheatley, and here's what she said. There is no power for change greater than a community discovering what it cares about. And one of the beauties of being here in coastal Mississippi is that, or in Mississippi for that matter, to be honest with you, is that we have so many people in this state who are working overtime to make this a better state. And, they're working in the trenches. A lot of folks in the nonprofit community are working, terrific board members that are contributing their time and energy and expertise. But when you have moments like Katrina, it has a way of defining for us what is in the heart and soul of Mississippians. And I think we've done a really good job of trying to understand, or better understanding. You never arrive. It's a constant journey, and needs change. But I think we are doing a really good job of understanding what we care about. Okay, and the second one is from Coretta Scott King, and she said this: the greatness of a community is most accurately measured by the compassionate actions of its members. And I think when back in the early days of my tenure as the president publisher of the Sun Herald, I think a second year, I wanted to do a couple of things. I wanted to create a leadership awards effort that held up as examples leaders in the community that were doing great things. And my team and I set out with help from John McFarland, I might add, who recently passed away. John was really very helpful in helping us get this thing moving. But we created what at the time were the Sun Herald Leadership Awards that became the One Coast Awards. But I think it was important to us to hold up as examples the people who are working so hard in this community, so that others can emulate them. So it's great recognition for sure, but it is really a great opportunity to learn from them so that others can be inspired and they can find their role to play in the community. So today, the One Coast Awards it's done at a breakfast at the Beau Rivage, and it's a collaboration between the Coast Chamber and Hancock Chamber and the Jackson County Chamber and the Ocean Springs Chamber, and they do such a good job of sort of pulling it all together. And so over the course of the next several weeks, actually, I'm going to be circling back with this year's winners, 2023 winners, and I look forward to holding each of them up as an example. And today, I had the opportunity to visit with Angel Greer, who has a key role in leading Coastal Family Health. We'll tell you more about what that is here in just a second. But without any further ado, let me welcome Angel to the Ricky Mathews Show. How you doing, Angel?
I'm great, Ricky, and thank you for the invitation. This is quite an honor.
Oh, it's great. Good to see you. Congratulations on your recognition.
Oh, thank you.
I used to literally said to people when I would call them and say, you're a winner this year, and I would thank them for their service. And then I would say, thank you for enabling us to use you as an example, because I think, when we can focus on what you've done, when we can hold your story up as an example, I think it is inspiring for others. And you have to understand and realize that as you do your day-to-day work, that number one, you hope that you're serving as an example to others, and there's an additional burden on you to do a good job, isn't there?
There is, and actually, I see it a little reversed, quite honestly. First is to do a good job, and then you hope that by doing that, following your passion, following your heart, then you can be an example to someone else.
I totally agree for sure. Listen, you went to University of Southern Mississippi. So did I. Yeah, to the top. Yeah, I've had Dr. Joe Paul on a couple of times. Really happy and proud for him, that is for sure. But as a chief executive officer for Coastal Family Health Center, why don't we, obviously we need to frame what that's all about. So what is Coastal Family Health Center?
Coastal Family Health Center is a private nonprofit organization. We were established in 1976 to provide comprehensive primary care to the coast, regardless of anyone's economic status. A couple of myths and misnomers out there is that we're with the health department. And while the health department is a great partner of ours and has been for decades, we're not the health department. We're a private nonprofit entity. And then the other misnomer is that we're a free clinic. And we've partnered with free clinics over the years, but we are required to collect for our services, but we're able to offer a discount with the funding that we receive. That's a little bit about Coastal. And one fun fact is that we were birthed out of Back Bay Mission, a faith-based organization to provide health care way back when. And so that's a little fun fact about Coastal.
You know, it's interesting. I think sometimes we forget who is the average Mississippian. In fact, recently I went back and studied some of the most recent census data. And it's important to see this. First of all, just in terms of total population, Mississippi has 2.9 million people. Of the 2.9, 573,797 actually live in poverty. I mean, we have to recognize that. The majority of Mississippians, over 51%, actually live in rural areas, which I find very interesting. You mentioned faith-based. 83% of us are affiliated with some Christian-based faith. 83%. So religion is really important to us in Mississippi. Average income is $34,000 a year. And average household income is $46,000. I mean, that's the average of the 2.9 million. You know, a lot of people are working two jobs there, and what I say about that is that the average Mississippian is just working to make ends meet. That's just the reality, and you see that every day in the work that you do, don't you?
Yes. You know, I'm so appreciative that you are quoting, you know, those statistics. And, you know, the truth is that the majority of Mississippians are one paycheck away from experiencing homelessness. And so it is a real serious situation for us. But, you know, the interesting part of all those statistics, Ricky, you know, with Mississippi being the poorest state, we're also the most giving state. Isn't that a phenomenal
It's always blown me away. It has been first, second, or third, or certainly in the top five over many, many years, going way, way back. In fact, I actually read this morning where giving is down about 3% nationwide, and so it creates challenges for organizations like yours. And I'm not surprised by it. I mean, inflation has been extraordinarily high and putting pressures on families in ways they've never done before. But even with that, I think that when you see how we rank again this year, that we will, in spite of our challenges, because we've done it in spite of our challenges in the past, we will still be one of the most giving states in America. I think it. You know what I think it is. We've talked about this on the show many, many times. But what is in the heart and soul of Mississippians? You take politics and the divided world that we live in, and set that aside for a second. When the going gets tough, I mean, we want to help our neighbor. I mean, that's just at the bottom line. That there's something good about us, isn't there?
There is, and that's the true testimony of Mississippians, is that no matter how difficult things are, like in the wake of Katrina, you know, we help our neighbor. And I just happen to have the great honor of working in an organization that has a decades-long, 47-year history of doing just that. And so I stand on the shoulders of some pretty incredible people that started with nothing other than a passion and a vision, and just grassroots.
Well, okay, so when you think about organizations like yours and so many other non-governmental organizations that are out there, what we see is that they're usually guiding that as an executive director and a board that understands that the more they do the work that they're particularly focused on. All are focused on different. Some focus on the same, but that's okay. They're not competitive. There's a lot of gaps to fill in this community. But the more you understand what the needs are, the more you want to grow your organization, the more you want to increase the amount of funds, the number of grants, the number of locations that are available. And one of the things that was impressive about studying your past, Angel, is just how much your organization has grown under your tenure. But that is an example of when you take a very strategic approach to your organization and you have a dedicated board of trustees, that you can find a way. You can find a way to fill more gaps, going from 3 counties to 6 counties and beyond. You've had a lot of success, but there's still a lot of needs, aren't there?
There are a lot of needs. And talking about the growth of the organization, the growth represents the need. If the need goes away, if we can establish affordable health care, if we can establish healthy communities, if we can get a handle on these chronic diseases where people can, remain employed full time, then we won't have a need for, organizations such as ours to grow. And that's really our goal. My goal when I first started in this position, I was asked one time, what is your goal? My goal is for us to, move Mississippi off the bottom to the top.
That's perfect. Hey, when we come back, we'll continue our conversation with Angel Greer. Welcome back to the Ricky Mathews Show. I have Angel Greer with us. She's the Chief Executive Officer of Coastal Family Health Center. And I remember when our content producer, Cammie Martin, and I were talking, and I read about you, I thought, wow, we could have done a full show, and we probably should circle back and talk more specifically about the work that you guys are doing. But, it's interesting. John Harrison said in the early days of COSU, now Ricky Mathews Show, John's a longtime friend. We worked in the community for many years. For people who don't know John, he's the CEO and chairman of the board for Hancock Whitney. He said that people who work in the community don't just go lead an organization. They have to do their reps. And they have to learn how an organization works, and then they go do something else. But if I look at your past, Angel, you've done your reps. You've worked hard to prepare yourself to be the CEO of this organization, haven't you?
Maybe looking back, I could agree with that statement, but that certainly wasn't my forward vision, during those years. It was just trying to learn what I needed to do a great job, to serve my, friends and family and neighbors, in the job that I had.
How do you describe your leadership style?
It has culminated to be very focused on serving. In the early days when I was studying leadership and trying to figure out who I wanted to be and how I wanted to lead, I thought I had in my mind, transformational, and that's still a portion of it. But honestly, where I'm at, decades later, I'm 30 years into my career, it really is about serving, from serving our patients to serving our team. I believe that we as leaders have a responsibility to the people that we employ to take care of them, to grow them. And to help them develop in ways that they're interested in developing, just as, we're interested in partnering with patients to improve their health to the extent possible.
It's interesting. I think if you were to look, and one of the beauties of SuperTalk Mississippi is that we're in a position where we can have conversations that inspire and reflect on the lives of Mississippians in a positive way to hopefully help people sort of, fight their way to a different level. I mean, I think, I certainly had to climb and conquer a bunch of mountains during my career, during my life. And I bet there are a lot of Mississippians who feel that way, that there are mountains to conquer. But I think at the end of the day, one of the things that your organization does, not only just meet a need, but by the people you involve in your organization, the people you have a chance to touch every day, is to inspire them that they can reach their goals. And you see that, don't you?
I do see that. I can remember being a patient on our sliding fee program, as a young mom with a child on Medicaid, and seeing these healthcare professionals or just, front desk workers and thinking, I could never do that. I could never do that. That's not my station in life, but I have lived through the truth that it doesn't matter where you start. It doesn't matter where you're at today. It doesn't find who you are as a human being. The decisions that you make and the actions that you take really determine, your trajectory. And so I've been fortunate to come across many people who helped support me, encourage me, and inspire me, throughout, years of mistakes and missteps and stumbles.
You heard what I said, and you knew these numbers well, that over 51% of Mississippians live in rural areas. And healthcare for the United States is a real challenge on so many levels. We know that. This is not what this conversation is about. But I don't, I look forward to leadership in our state sort of grappling with what does the healthcare providing look like in the in the future of Mississippi? Who's going to grab that and say, we're going to re-engineer this? We're going to start to think about how do we adequately provide health care to people in rural areas, especially in places like the Delta, where I spend a lot of my time, because it's going in the wrong direction right now, isn't it?
Yes. I can't speak for the specifics of the Delta, but I will tell you that healthcare just across the nation is going in the wrong direction. We call it a healthcare system, and it is anything but a system. And I've had multiple conversations over the years with our local hospital CEOs, independent healthcare providers, and I believe somewhere part of the answer is a community network. There has got to be. Coastal can't be everything to everybody. The hospitals can't be everything to everybody. But if somehow or another we could figure out how to work together and synergistically, utilize our resources to cover the gaps, eliminate duplication, decrease costs, it could be a more perfect world, or certainly, moving in that direction.
Angel, I wish that you and I had been talking during COVID, during the height of COVID. We'll definitely stay in touch now going forward, because there's so many other conversations to have. But it's pretty significant testament to you and your team that you survived the COVID challenge.
It was a challenge. And I don't know if our conversations during that time would have been fruitful, because we were really grappling every day trying to figure out how to take care of the community, how to take care of our team, and take care of ourselves.
Hey, everyone was grappling like that. Everyone. I don't care what kind of business you were in. Everyone was grappling. It's particularly every single person in the healthcare community, because we were dealing with all these variables that were being thrown at us and that we've never had to deal with before. And so, doing the best we could to sort of work through that. But hey, listen, congratulations on your One Coast Award. It's been a pleasure to meet you. And I can't wait to have you back. We'll dive deep into your organization and what makes it tick. I look forward to having that conversation.
I would love that, Ricky. Thank you so much. I look forward to next time.
You bet. This has been Angel Greer, and a One Coast Award winner, community leader, and someone I have a lot of respect for, and we look forward to diving in deeper in the future. Have a great weekend, and we will see you on Monday.